This is Sibel, and I'm doing a neurological assessment. As I ask my patient to come in, I'm going to witness his coordination, gait, and muscle tone, whether it's equal or uneven. Also, how he carries his shoulders, and if he shuffles or if he has a nice steady gait. Hi, John. Come on in. Have a seat. So my name is Sibel, and I'll be your nurse today.
Okay.
I'm just going to do a neurological assessment and ask you a few questions. Is that okay?
Yes.
Okay. Your name and date of birth, please.
John LeClaire, 2274.
And do you know what season it is?
Fall.
Okay. What day is it?
Monday.
And do you know where you're at?
Yes. Here in our spare bedroom.
Okay. When did your wife graduate from RN school?
May of 2018.
So I can see that my client is alert and oriented ×3 to person, place, and time. John, do you have any allergies?
I have food allergies.
What happens when you are in contact with those?
I have swelling in my face and my throat gets itchy.
Do you have airway problems then?
Yes.
Do you have an EpiPen for that?
I do.
Okay. And it's not expired, is it?
No.
Okay. Have you recently taken any pain medication that I need to be aware of?
Acetaminophen.
Are you in pain right now?
Just some lower back pain.
On a scale of 1 to 10, what is that pain?
Probably a 4.
Okay, and you just took acetaminophen about a half an hour ago.
Correct.
Okay. So I have observed his posture and his position. He has a straight back, no lordosis or kyphosis, even muscle tone. I can see that his general appearance is good hygiene, well groomed. The pain level is been addressed, and his vital signs. So his blood pressure is 120/60, heart rate is 78, respirations are 18. His SpO2 is 99% on room air. His temperature is 98.7, and his blood sugar is normal at 80. He has recent and remote memory. His speech pattern is clear and concise, and he has good thought process. So right now, I'm going to go ahead and also note that we have a Glasgow Coma Scale. You have eye opening, you have a verbal response, motor response. You've scored a 15. Congratulations. I'm going to perform a Romberg test and also do arm presses, leg presses, and I'm going to ask you to close your eyes and touch your nose, and we're going to test your strength. Is that okay?
Okay.
Okay. Before you stand up, let's go ahead and test your leg strength. So if you go ahead and push up with your knee. Excellent. Push up. And I noticed that that is equal. And I'm going to do grips. If you go ahead and squeeze my hand. Okay. Equal grips. And I'm going to do pedal pushes and pulls. Go ahead and push and pull. Okay. Great. So pedal is also equal grip strength, push and pull, pedal. I'm going to ask you to stand up. Is that okay? Okay. So if you stand, I'm going to ask you to just stand with your legs apart, just like shoulder width, and I'm going to have you close your eyes and bring your hands straight out in front of you, and just stay there for a few seconds. So right now I'm just witnessing if he's going in balance to one side or the other, forward or back. And that would tell me if the cranial nerve number 8, you can open your eyes now. So he's negative. If he were positive for a Romberg, he would have a loss of balance. And I'm going to go ahead and if you were to stand there and close your eyes, I'm going to ask you if you feel or not feel any sensation. Do you feel that?
Yes.
Okay.
Yeah.
Okay. You do it to your legs.
Okay.
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 Okay. And go ahead and have a seat real quick. While I'm here and I have this instrument, I'm just going to go ahead and do Babinski's. Go ahead and bring your foot up right here. all the way up. So he is negative for Babinski's. I'm going to do the other foot too. No fan or flare. And then so that tells me about the deep tendon reflexes. If there were a fan and flare, I would definitely worry. The cranial nerves, we'll get into that. Right now we're going to do the cardinal, 6 cardinal directions of gaze. And this is for midbrain ocular motor, cranial nerve number 3, midbrain trochlear, cranial nerve number 4, and in the pons, the abducens, cranial nerve number 6. I'm going to ask John to just go ahead and look straight at me, focus on my nose, and what I'm going to do is I'm going to ask you to look at this light. Okay. Now follow the light. Okay. You go left, back to center, patient's right, back to center, and that lets me know of the nerves going back and forth, the medial rectus and the lateral rectus. And I'm going to go towards your nose, just follow the light. And good. Okay, and I'm going to go up. There's cranial nerve number 3, back down to 4, back up to 3, back down to 4, and down, and up to the middle, and down, back up to the middle. Okay, excellent. So he has a great gaze, both lateral, up, down, and diagonally. That is those optic nerves 3, 4, and 6. We're going to go for the olfactory nerve number 1. So I'm going to ask you to close your eyes. And I'm going to bring something to your face. I just want you to smell. Okay, 1, 2, 3, smell. What does that smell like?
Peanut butter. Peanut butter.
Okay, you can open your eyes now. So the olfactory nerve is working just fine with John and Skylar. There's another test for optic nerve number 2 that I can do. It's the visual acuity, and we just tested the visual fields. But I'm going to go ahead and ask John to cover one eye and take a look at his visual fields. Actually, I'm going to cover one eye. Okay. And I just want you to focus, keep your eye on my nose. And I'm going to ask you, how many fingers am I holding up without looking at them?
3.
Okay. How many?
4.
How many?
2.
How many?
2.
Okay, great. That's the optic nerve number 2. We're going to do the other eye too. Okay. Look here.
1, 3.
Okay, good job. The cranial nerve number 3, which is in the midbrain, ocular motor. We're going to assess Perla. So I would go ahead and tell him he's going to get a bright light shined in his eye. 1, 2, 3. And 1, 2, 3. Good job. So his pupils are equal. They are round. They're reactive to light. And I'm going to test accommodation. So I'm going to ask you to look at this light. Okay. Now look at the far wall. And back to the light. So I can see that he dilates and constricts when he comes closer. So his ocular motor is doing great. I can also see that there's symmetry and that open and close just fine. The trochlear nerve number 4 is his cardinal gazes, downward, upward, and to accommodation. We took care of that. His facial sensation. So on the trochlear nerve, we're going to with the trochlear nerve, it's the cardinal gazes, and it's downward and inward movement and accommodation. The trigeminal nerve, number 5, is the facial sensation and the maxillar and mandibular strength. So I see that he has no problems eating, that he has equal strength, and I'm going to ask you to close your eyes and ask you if you feel anything.
Yes.
Okay. One more time.
Okay.
It's also the temporalis muscle. I would ask him if there's any pain when he eats or brushes his teeth, and he states no, right?
No.
Okay.
Right.
The abducens, cranial nerve number 6, is also the cardinal gazes. It's the lateral movements of the eyes back and forth. Facial nerve number 7, I'm going to ask you to puff your cheeks like you're holding your breath like a kid. Yep. And so it's nice and equal and nice. Big smile, big frown. So everything's equal. There's no drooping on one side and it's all symmetrical. We went through his cranial nerve number 8, which is the vestibulocochlear. He had a negative Romberg test. He had good balance and proprioception, awareness of where his body was. If he didn't, he would be positive Romberg, and that would be a problem with ataxia. So the gag reflex and swallow, John, I will not stick this down your throat, but I would ask him to open his mouth, shine a light, and I see that everything's equal. You don't have a uvula.
I do not.
What happened to your uvula?
It's cut out.
And I would just enter this into his tongue and go back into his throat and just to tickle the back of his throat a little bit. And he, of course, would.
Gag.
How? Do you gag? Okay. So I also want to ask him to swallow. So swallowing is good. He has no problems, hesitation. I don't see any food in his mouth from pocketing or anything like that. And I can see that his neck is midline. And we're going to go on to the glossopharyngeal nerve, which is nerve number 9. That was the gag reflex. Sorry, we're going to move to 10, which is the coughing, gag reflex, muscles of the pharynx, larynx, soft palate, thoracic, also abdominal viscera, and the parasympathetic innervation of the thoracic and abdominal regions. So his vagus is working just fine. He can cough and clear excretions. He does have a gag reflex, and with cranial nerve number 9, he is swallowing okay. The spinal accessory nerve, cranial nerve number 11, is just, if you can shrug and let down? And can you move your head to side to side? So cranial nerve number 11 is working just fine. Number 12, the hypoglossal, is movement of the tongue. That's good. Okay, so he has movement of the tongue. And so in assessment of the nervous system, I would make sure I do the health history. We addressed his pain. Do you have a history of seizures?
No.
This is partly what I would have asked beforehand. Any dizziness or vertigo?
No.
Okay. Have you had any visual disturbances, like blurred vision, double vision?
No.
Difficulty driving at night because of your age?
No.
Have you had any muscle weakness?
No.
No. Other than you're tired?
My back hurts in the morning.
Okay. Have you had any recent falls or injury?
No.
No knocks to the head or anything?
Right.
Okay. And he has no family history of epilepsy and no use of illicit drugs. So he is good to go for the neural assessment.
Yay.
Thank you, John.
Thank you.
I appreciate it. You could give Skylar the Thank you. Bye.